All right, hello again, and welcome to another Down Fracture podcast, a podcast for talking jaws. Dr. Michael Wasson here with Dr. Sam Bobek as always. Sam, you had a birthday recently, and I got to ask, how do the 50s compare to the 40s?
Yeah, no. I'm getting close to the 50s, but I'm not there yet. So, um, I was 46, so felt pretty good. I mean, I'm not too old.
Gross.
What?
That's disgusting, man.
Just I definitely identify as the 50-year-old man. I definitely hang out with more people of that age than I do the younger crew. You youngsters, it's just hard to keep up with the internet and all and phones. Uh,
In your MTV,
yeah, MTV.
your
Yeah,
rock and roll music.
we just sit in our wooden rocking chairs and watch the wind blow. It's pretty nice. But yeah, no
Uh,
thanks. It was good. Adult birthdays, especially ones that are on Mondays, really bit anticlimactic. So next
yeah,
year,
birthdays become anticlimactic when you have the ability to not go to work, but you still do. Like,
yeah,
it's just like, oh, I'm just gonna go to work.
yep,
Not a
yep,
big deal. Get to
definitely
go to
adult decision
school.
making. Uh,
Um, well, per
yeah, so
usual, you've got us off in the weeds talking about nonsense. Downfracture podcast at gmail.com. We got some emails, been corresponding with people, some good input, some good ideas, suggestions, etc. So keep that coming. If you have something to contribute, check us out on YouTube, Insta Chat, Facebook, Graham page, and all that fun stuff. We have stuff up there that's mostly useless, I would say, but it's there. And what do you want to talk about today?
we have a little bit of a time constraint because we're on a different day today, and you have some family activities, and so we're going to come up with a little shorter topic. Um, and I forgot our cutesy little name we came up with. I think it is head position and lips. It's a little thing that count. Is that something like that?
Head position and lips. It's the little things that count. You got it.
Yes. So I think there's a couple nuggets on these two things in terms of useful things that make every jaw surgery better. And
Okay.
it is looking after the lips and putting the patient's head in a neutral head position and keeping it there during the operation. So, what do you think? Not crazy, in-depth conversation, but to me, I find both of those to be very helpful in the surgery itself and then managing things after surgery. So,
Definitely. And, I guess we can start with the neutrality of the head position because we recently talked about this a few months back because I had personally a few patients who had some pretty sore throats, is what I noticed. And I couldn't figure out what it was. And I had changed, I operated a couple different places. I've done a couple of things over time. And, we talked about it. And you asked me about, what are you doing for the head? And I said, I'm just putting them in the little jelly donut, try to hold them steady. But with that, when you're retracting, the head has a tendency to go side to side. And I've witnessed firsthand that I think, especially with the nasal intubation and it's the ET tube being where it is, if you're turning the head and altering the length of the ET tube and position of the ET tube slightly, when you do that, I think it can lead to increased sore throats. You have the same
definitely.
philosophy.
Oh, for sure. I mean, I feel like I learned a bunch of different ways to hold heads, and the jelly roll or the jelly donut under the head is a nice one because who doesn't like jelly donuts? You probably don't like jelly donuts, actually. You're probably like a Bavarian cream kind of guy.
Don't you pigeonhole me. You don't
Disgusting.
know.
Yeah. So jelly donuts, they're so nice. So and it's fun using them, and they seem comfortable. Um, I think there is all sorts of different ways to hold the head. I came across the bean bag. The bean bag, I believe in Seattle. I feel like I didn't learn about the
Yeah.
bean bag head position until Seattle. And
That's
I'm
how, yeah,
sure
that's how we trained with a couple of people is that specific beanbag that you use, and sometimes a little bit difficult to track down those things.
definitely. And so there's some nice things about the jelly donut, but there's some not nice things. And one of those is, the head can move a lot. And during surgery, whether it's side to side or extended or like diagonal extended, with the endotracheal tube fixated to the nose or to the forehead, either way you do it, the end of that tube is moving. So as that head moves, the end of the tube is moving. It's moving up and down. That balloon is irritating things. Even if you're using an extended endotracheal tube, that thing is moving. It's a fixed point. And so I think for a sore throat standpoint, makes sense. Also, just from a securing airway standpoint, it makes sense. I don't know about you, but at my hospital, most commonly the diameter of endotracheal tube is the main factor of lengthening the tube. So you can't get like a 6.0 extended length endotracheal tube for nasal ray. So you have to go in a bigger diameter to get a longer tube. So if you have a tall person with a small nose, seems like that cuff is always right at the cords or right around the cords. And so keeping their head in a neutral position is rather important to make sure you don't accidentally extubate them during the case, you know?
Yep.
So definitely that. I think the other part of it though is keeping their head in a neutral position is good for their jaw position. So I think seating condyles are sneaky hard if their neck is getting extended or if it's going side to side. As you open
Hmm.
your mouth opens, as you close it, the mouth closes. And so you're getting this external factor that's influencing your pressure onto the proximal segment. And honestly, even how you seat the occlusion in the intermediate splint or the final splint, the head's throwing you off more than you think, is what I have noticed over the years. So what do you think about that?
Yeah, that's an interesting point. I hadn't given it much thought, to be honest with you, but it does make a lot of sense that it's certainly not helping how much it's affecting it. I don't know that I could say that I've thought about it in real time to give a good solid take on it, but what you're describing makes sense. I mean, it also just affects your visibility and how you're perceiving it. If you're looking at it in one way and then it's a different position, I can see where that would have effects. But
You know,
no,
the
I mean, I think
person
that's an
at the
interesting
head of the
point.
bed, you know, and classically in resident jaw surgery, there's, you know, the intern who, you know, is rethinking their life decisions and is sitting there bored out of their mind, retracting for a two jaw and basically just pulling on his the toe ends as hard as they can, you know.
Hmm.
And you know, the head's going like this, and then they're starting to bubble in the back of the throat, and they're like, ah, just put some gauze back there.
Right.
Or you know, let's turn the pressures down, the anesthesia. All that's the same thing, which is head position. So keeping
Hmm.
them in a neutral head position for the case, if you can, is great. It's just really hard to do that without a beanbag. Do you have any other solutions other than a beanbag that holds them there?
I mean, I've seen people tape the head, tape it to the table.
Sure.
I've seen oh my gosh, you guys used it in Portland all the time. I can't think of the extension off the head of the bed that you can move.
I also was trying to come up with that earlier on this discussion.
Oh man,
I
why
haven't
can't I
used it
think
in
of the
such
name
a
of
long
it?
time.
That
But
was kind of cumbersome and it would like hit your knees and stuff sometimes. And like it wasn't the easiest, but I feel like that does a better job than the jelly donut,
yeah, I mean,
especially if you tape the head to it.
yeah, there's you know, like the articulating dental head attachments, right? Like if you do jaw
Hmm.
surgery in a dental chair, that actually does an okay job actually of keeping their head. But not still as good as the beanbag. Beanbag, U-shaped beanbag, those things are great. I feel like in my mind I chalk that up to Feldman, but if that's a Farrell thing, I apologize. Uh,
No, it's definitely a Feldman Bloomquist thing. I mean, you may have gotten it with Farrell or other people too, but we absolutely use those. And I think that's one of those things you don't realize its impact until you don't have it anymore. And then
yeah,
it's like, and I mean, do you have one that you could show us? Do you want to run and go get one?
I could. Yeah, you want me to grab it?
Yeah, why don't you
Hey,
do it? Because I don't think people really understand what we're talking about.
we
And
can
the show
also pull it
gets,
up on the internet. You want me
oh,
to
good.
just find it?
You can do that. I mean, when I bought mine or had them ordered at my hospital recently, it took some work to find it. Do you know exactly what
Um,
it's called?
let me know. I'm seeing pictures of lots of people enjoying beanbags. Um, you know,
I
my
was hoping
dog
you just
enjoys
go,
beanbags. I'm gonna go grab it. I'll be right back.
yeah, go grab it. The show's better when you're not around anyways. So I guess to fill some dead time, I'll kind of describe this thing to you. It's a suction vacuum bean bag that's U-shaped, and you can put it a couple of different ways, but normally you put the open U shape goes superiorly or cranially, and you get a little support under the neck, and then you press it against the sides of the head and then do suction onto the valve there, and then you can seal it off, and it stays. full and rigid the whole time so that the head doesn't move side to side. I have seen people actually do like gel packs on either side or just random like hand sized or a little bit bigger. So long bean bags on either side of the head, tape the head to the table, um, tape up towels and put them in certain ways. So I'm sure there's a lot of tips and tricks, and maybe this is something we'll get feedback from the audience at large as to how they do this. But if you don't have the vacuum sealed bean bags, it's definitely worth checking out for this purpose alone. And I think Sam was saying, and we'll get when he comes back, we'll talk a little bit more about he uses it for all aspects of his surgeries, TMJ surgery, joint replacement, everything. I'm mostly utilizing it just for orthognathic surgery because it can be a little more difficult to turn the head side to side. You have to lift the head up, turn it, and if you put a lot of pressure on either side of the beanbag, it can prevent you from turning as far, or it can make it kind of awkward on the side of the face. So to each their own on that, but it does do an excellent job of keeping the head still, no matter kind of what you're pulling and tugging or assistants are pulling and tugging on to do it. And he has taken an extraordinarily long time to go find this. So I'm going to pause the
Editing's gonna cut that out, right?
I talked for a little while and then I paused it because I thought you were just like running to the next room
No, the
to get
reality
this
is if
thing.
I step out, then people are gonna start asking me questions, and it's gonna be like, you know what it's like. Family's there.
This is easily going to be our worst episode,
Really?
and that's saying something.
You think so?
Like, yeah, because of that.
All
Yeah,
right,
do you got it to show us?
got it.
All right, so hold it up so people can see it because
Is it
I was
recording right now? Are we
yeah, yeah, I
interrupting?
recorded again. Yeah,
Oh,
so
good. All right.
I just hit
Yeah,
I just
so
restarted.
from a bean bag, it's a U-shaped bean bag. It's probably got like the formal name of it. It says Olympic backpack on it. This is pretty old school. It's got this guy. I mean, I feel like I'm using a prop here, but generally this seems ridiculous on the camera, but underneath the head. And so that way it squeezes up and you can hold the head in a good spot.
Yeah, you may need to unblur your background for that. But
I
yeah, I
know.
was kind of
I
describing it while you were going on your
I think the
journey.
nice thing is you can hold that in a neutral spot and you can push it up a bit. And the vacuum bag holds it in a good location to where it's reasonably stable throughout the case. So the head doesn't drift towards you as you are retracting in the mandible, and it doesn't drift away from you as your retractor is retracting in the maxilla. So
Okay. Yeah, I was saying while you were gone, when I was trying to fill the dead space,
yeah.
that you utilize this for all aspects of surgery, is what you've told me, right? I was saying I mostly just use it for orthognathics. Do you not find that when you compress it on the sides and you try to turn the head for like TMJ surgery, do you not feel like it can get in like in the way a little bit?
Yeah, for sure. I feel like I do like detaching the suction. So,
Right.
I have two of these at the hospital. This is my one from my office. Um, and one of them you got to leave on continuous suction because once they have a little crack in the seal, it just has to be on continuous suction. And the other one holds suction on the little mechanism. And you can just take it off suction and then reposition it for the new head position. Um, in practice, I tend to just make it a little flat on each side, so when they turn their head, it's not too bad. But
Got
the goal of it, which is minimizing head movement during surgery, is much easier with the suction beanbag. So,
So let's say you come to work one day and Wanda has eaten your beanbag.
yeah.
What's your alternative? What would you do in that situation?
Um, get a new dog. New dog would be priority number one. No, I mean, I think I would likely tape. So I would probably use some bumps on the side to minimize. I'd probably use a jelly roll bumps and probably do some taping to hold them in place. So,
And tape across the forehead, or what do you mean by taping?
um, because I really just don't want the head to move side to side. And if I'm at the hospital, I got to come up with something on a flat table. In my office, I have more oral surgery chairs, and those do a pretty good job independent of the beanbag. So if you're using more of a typical oral surgery chair, it's a bit easier to hold their head in a good position because the head rest changes, right? Like you can flex the head and put it in a better position.
Yep. Okay. Makes sense. You got anything else on this topic? Anything
I,
else you
I
found?
think head position is important. I think it's good for the seating bit, and I think it's for the throat. So I would just say that try it out. It's an easy thing. They're a little bit hard to find, but if you're just paying attention to the head position next time when you're doing a case, um, you'll kind of see the benefit of holding them in that spot. I think there's some reasonable thought from patient comfort and neck soreness and all that sort of thing. It's much better if they aren't getting their head turned the entire time. So
Yeah, I mean, I will say my longest that I can remember admission following jaw surgery came from extreme sore throat, which I kind of attribute to this. So I mean, I think it's a real thing in real practice. The they are still available to order because I've my hospitals ordered them within the last 8 months or so. So they are out there. And then you wanted to talk about lips too.
yeah, well, I mean, head position I think is a sneaky thing that just makes it easier. Less sore throat. Obviously, sore throat's not going to be a deal breaker. So if you can minimize sore throat, it's just patients are going to do better. If you can keep their head in a reasonable position that makes your jaw surgery easier, why wouldn't you, right? I think
Right.
the lips kind of match this sort of thing. Looking after the lips. So I think we have all had the experience, and people likely still have this experience where you're doing jaw surgery in someone's mouth, you're making relatively small incisions, and you're focusing on splitting jaws, putting them back together, getting splits in location, and it's a giant wrestling party with the lips. You're thinking about retracting the incisions, and really the lips are an afterthought. And when you get done with the surgery, you have little sausage lips, the not even little ones, just like this round. Looks like the lips went through um, round of filler or something like that. And it only gets worse from there. You know what I mean? Get cracks on the side of the lips. Maybe there's a little bit of an abrasion or a scratch from a wire. Those things get better. Long-term trouble with that is really rare, but it sure makes life easier if your lips don't look like that. And I am of the opinion that once lip swelling starts happening, it starts making the case harder in a sneaky way. So what do you think about that? Once lips start getting big, it just makes access
Yeah.
harder. It just makes your retraction that much more difficult. And why
I
make it
can't
hard on
remember.
yourself?
I can't. I don't know that I've ever had lips get swollen, so it's hard for me to say. I'm sure that's more common in your practice than mine. Um, but yeah, I mean, I could see
Sure.
why that would be a problem for you.
Well, I think you were surprised to find out that lips shouldn't be immediately huge. You just haven't seen in your patients with normal lips. Yeah, so minimizing lips. I think keep looking after lips because at the end of the surgery, the patient looks like they didn't really have surgery. Um, all you're doing is setting yourself up for success there. And so I think you forwarded me something from the internet on some of that MEOS stuff and how it minimizes swelling and everything. You can do all that without any fancy instruments and looking after the lips, caring for your soft tissues, head position. These sort of things make a difference. So I think the lips are important.
No doubt. I mean, if nothing else, the patient perception, which does matter. I think when you're trying to assess occlusions in the immediate post-operative period or even intraoperatively, if the lips are just massive, swollen, distorted, that check is much more difficult. The nose is already a little distorted from a unilateral ET tube. You got massive lips, and you're trying to evaluate, hey, did this plan go as planned? Are my midlines on? Was there an error in my records? I think it makes that more difficult. Patient perception, as I was saying, family perception. I think you're going to get a lot less phone calls and worries and other stuff. And then I think it just makes you look like you know what you're doing, which is important,
It
in
is
today's
important.
world where there's chat rooms, chat rooms, man, I'm sounding like a 50-year-old like you, but there's forums and online
You don't know.
communities where all these things are happening. People post their photos. So it does make a difference in that. And then intraoperatively, yeah, I think we talked a little bit ahead of time, be careful with your drills. is another one. Be careful with your wires. For me, anytime there's like a pause in the surgery, I grab more hydrocortisone ointment and just slather it on there.
Lip goo is the best. Using lip goo
Yeah.
during surgery, there's definitely a plus minus, and getting over the negative of it will be worth it. So if you're new to introducing hydrocortisone lip ointment to the lips, it is going to irritate you because it will find itself onto your instruments, and those will be a little more slippery. And so I think if you can navigate that and somehow find a way to not get your instruments all lathered up with lip ointment, it is going to be way better.
Yeah,
When did you start it?
what's that?
When did you start using lip ointment?
I think honestly, you turned me on to that years ago. Like I can't remember if we did a case together in Portland or something, or it was when I was in practice and we were doing something together. Because we would use like Vaseline, or we would use just lubricating jelly. But the actual hydrocortisone or triamcinolone ointment, I think you kind of turned me on to that
Yeah,
years and
so
years ago.
that's definitely a Charlotte one, and now I just fuss about it. I mean, I like being in charge of that. I have a little dollop of it on the Mayo stand, and it gives you a little pause. If the lips start getting a little dry, you can just lubricate those real quick. I find I like personally to be in charge of that rather than the assistant. The assistant adding lube is always kind of awkward, but I think that keeps the instruments from catching lips and pulling on things and causing cracking. Um, and I don't know, I think it's partly the fact that you're putting the medicine on there, but it's also that you're paying attention to it, right? Like your attention, at least somewhat, is on this access to the incisions, so that you aren't just pinching lips, because it's actually really easy to pinch lips. It's super easy. Like you have a tone, or let's say you're using a Minnesota and you're using a drill, maybe you're putting some screws in a plate on your sagittal osteotomy. It is very easy to catch a lip and pinch it while you're doing that. And pinching a lip, they start swelling up pretty easy. And minimizing that as best you can is important. So keeping the lips flipped out on the maxillary retraction from the strong intern that I've been talking about. Obviously, that can be anyone, but if the lips are turned in, you'll be causing lip trauma unnecessarily. So just keeping those guys flipped up as best you can. And as residents, you could be thinking about this in trauma, right? Like these are just good principles in surgery. I mean, you don't have to worry about when you take out wisdom teeth, but if I'm doing a 2.5 hour wisdom tooth extraction, I got to care for the lips. I'm joking. It's not 2.5 hours, but if it's a longer dental alveolar case, there's also nothing wrong with everything we're talking about, right? Like a all in
Right.
four case or nerve repair or whatever you're doing, right? So looking after the lips, not pinching them, lubricating the lips, and just minimizing that swelling is just going to make it a lot easier for everybody. So
Yeah, I mean, I would even extend that just to whatever your incision or flap or retraction is. I mean, I kind of harp on the residents I work with sometimes about when you're retracting even your TMJ incisions, like they have a tendency to like, I don't think they do it on purpose, of course, but like tuck those incisions in and retract. And I'm trying to teach them, pull that out and up, and it helps a little bit better. So I mean, it's definitely more crucial from a long-term standpoint of the lips, but I think it applies to every aspect of surgery. You don't want to just crush your incisions. You don't want to tuck it in. Um, oh man, I was going to say something else that was just going to be amazing, but now I forgot what it was.
well, I'm dissatisfied. I'm gonna submit a star
Oh,
rating for this episode that's low.
you're not going to be alone. Um, the the other thing I would say is, you mentioned just paying attention to the lips, that sometimes thinking about it, putting the ointment on there just kind of gets you thinking about it. I think it also just gives things a little bit of a break. If you're waiting on an instrument or you're waiting on something and you take the instruments out so that there's not the constant retraction on them, and then you're doing that and you're putting the ointment on it. I think having that in your mind to give everything a break, put something on it, I think that helps as well. So you're not just in like their lips aren't just pulled into retraction for an hour and a half or 2 hours straight or whatever it is. Giving them a break to put on ointment, I think has benefit in that regard as well.
Yep.
Um,
For sure. And last one on that stuff is I just think you're less likely to scratch things, right? Like with wires or suture or whatever. If you have a little bit of a barrier there, it helps you out. Same sort of thing with thermal issues. So temperature from drill or I don't know, maybe an instrument that is a little warm, something like that. Um, Ointments just providing a barrier to help you out. So I haven't chalked up any trouble to that other than the instruments are a little slippery and your gloves can get a little slippery and understand that can be frustrating, but you can figure out a way around that. And it's just kind of a useful little tip. So I feel like those two, even though they seem completely unrelated, are two little nice tips that I don't know if patients would go out of their way to ask you to do. I feel like that would be unlikely, but they are going to be um, happy with those sort of things after surgery. So there's
do
nothing
you have
wrong
them
with
can
doing
do
the
you have
right
them
thing.
continue like do you give them steroid lip ointment to utilize in the post-operative period?
People have received steroid lip ointment. I don't intentionally give them that because when they go home, they can continue to use it. And once you see a fungal infection after using that, I think a clown is the best analogy there. Like it's, I don't know. When I was young, I was in the Midwest. There was Bozo the Clown. Do you know who that is?
I was
Um,
actually on the Bozo show, if you did
were
not
you
know
really?
this.
You were on the
I
Bozo
was.
show? Was that the
Yeah.
last Bozo show? Was that episode
Man,
3000?
this episode is just getting way off the rails. But no, it wasn't like the nationally televised one, but they because it was so popular, they would travel regionally and like
Yeah.
come and do shows. And I was on the Bozo show.
Did you do the little ping pong in a bucket deal? What'd you do?
Oh man, my parents would probably remember this better because I mean I was young. But there were games. I think I did do the ping pong in a bucket toss thing.
Man, you're
Um,
famous. How'd you
yeah,
not get in the Mickey Mouse clubhouse singing thing? What it's like child stardom. If you're on Bozo the Clown and then the only other thing is to hang out with Britney Spears. That was like it, right? That's
yeah. There was the main barrier was talent, in that like I didn't have any, at least not in that regard. Um, yeah,
yeah,
I
that's
would chalk it
crazy.
up to that.
Yeah, so I don't send people home with lip ointment. Do you?
You know, I have in the past, some of it is like, you paid for this in the OR and it somehow winds up in their room,
Yeah, sure.
without even me directing it there. And then they'll put it on, they'll say they like it, they think it helps. And I'm like, well, you paid for it, just put it in your pocket and take it home.
I
But the hospitals usually are now balking at that because then it's like they're dispensing medications that it's not prescribed and stuff. And so it's maybe not above board, but I mean, I haven't seen. I can't recall seeing, I've had patients get brush and other things. I can't recall seeing it like really on the lips, like you're saying, like a true fungal infection or other reaction. But I tell them usually only do it for a day or two if they
and
do.
it's like anything, right? Like I probably only saw that. I definitely saw it once and I might have seen it twice. And you see like one-offs and then you change your practice around this thing that is really rare. I think we all do that. So maybe it's a good idea to use it longer. I will tell you that cream is terrible. So
Yeah,
hydrocortisone cream is like the worst.
that
It's like
white, you're
there's
talking about the white pasty
conditioner
cream.
everywhere. It's
Yeah.
ridiculous. The oh,
Yeah, don't do
don't use
that.
that and think poorly of down fracture podcasts. The ointments really
You, you
the
want ointment.
opposite.
Yeah, where I operate, I asked for that one time and everyone in the room, residents, everyone was familiar with the cream, and I had that for a case or two, and I was like,
And it
this
looks
is,
terrible. It's just anyway.
it's what I would call bush league. What do you think
I
about that?
I think so. Yeah, I think that's right. And it satisfies our quota for old man saying. So
Oh, you think that does?
I think so. Bush League. I mean, yeah.
Hmm. All right. I
All
mean, you're
right.
the old man, you would know.
Um, yeah, all right. Well, hopefully at least one of those is a useful tip to someone. I feel like this got us to a bit of a shorter episode, cover some practical things. I think we are trending towards guests coming onto the show, so we'll see how that goes in the next few weeks. but I think those are it.
Yeah, that was something, I'll say. Well, yeah, that was another Down Fracture podcast, downfracturepodcast at gmail.com. Uh, I'm just going to apologize for this episode, but as I've said before, this is entirely free, and so you don't really get to complain unless you contribute.
Get what you
All
pay for.
right. Yeah, you should get what you pay for. I feel like we owe people money on after this one, though. All right. Well, till next time, Sam. See you later.
All right, man. Take it easy.
See ya.